So we have a new cabinet pick for the Director of Health and Human Services. This is RFK Jr. I think as physicians, there's a lot to be worried about here, especially related to vaccine denial and just like the general not misinformation or not recognition of, evidence-based care. But as psychiatrists, we wanted to comment on something that we are experts on more than other fields of medicine, that there has been a statement by RFK Jr. about antidepressants possibly causing gun violence or school shootings. So we want to answer the question, do antidepressants cause school shootings? I'm Dr. Nichelle Haynes,
I'm Dr. Kristin Lasseter.
and this channel is called Medical Mamas. We provide you with evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Based in science.
Okay, so RFK was recently, RFK Jr., I don't know if
Junior,
that
yes.
matters, was recently picked to be the head of the Department of Health and Human Services for the United States of America. And doctors, a lot of evidence-based physicians are having a lot of big reactions about this.
Mhm.
And you might see this on social media if you're on there. And it's, I want to explain why I think a lot of evidence-based physicians are upset about this
Mhm.
is because he has said some things, he said lots of things that are just not evidence based. They're not based on research and facts. And when you're just kind of spewing information that's not based on evidence, you can put out a lot of misinformation out there or things that aren't true.
And I think it's honestly like fine if people believe things that are wrong, if those things are not harming people, right?
Right.
I have seen additionally, I've seen physicians comment on this, right? But I've also seen people like nutritionists who have specialized degrees saying things like just the raw milk thing, or like removing weird things from foods or whatever, right? Like these are people who are experts in their field who are saying this goes against scientific information, this goes against the data. It's not just physicians. I think that anyone who's in the healthcare field can see that he is making statements that are not in line with what science says. And science is neutral, right? It is just saying this is how it is. And this is what we know, and this is what we don't know. And he's going against the information that we do know.
Yeah, this is totally an aside thing, but one of the things that I love about science is that let's say like all of our stuff got destroyed, like everything in the world, all of our
Mhm,
papers, every like documentation, like a bunch of
mhm.
people got destroyed, and then you started rebuilding things. A lot of things would come back different, right? Like there'd probably be a lot of beliefs that would be a little bit different,
Mhm.
and religions would be different,
Sure.
but science would not be different
Right.
because it's based on research and data, and that's just like really cool thing about it.
Right.
So
So science only changes when the facts change, right? So, the rate of obesity changes, and we can monitor that with science based on other things. And then we use science to figure out what those other things are, right? So, like, we are personally, I'm not going to speak for all physicians, but personally, this is really alarming. And I'm very hopeful that, maybe he will not be, what's the word? Like brought into office or like approved by whomever he needs to be approved by. So, kind of speaking along the misinformation line, we'd be really curious to see what information you're seeing, and maybe you had questions about it, or maybe you really believe something and you're like, hmm, I believe that, but is that true? We would really like to hear from you about like kind of what you're seeing, what things you're questioning, maybe what things are true, and we can, confirm or deny or provide information about that.
I mean,
Yeah,
particularly with mental health,
of
like
course,
we're not going
yes.
to comment on things that we are not experts in.
I'm not an arborist. Okay,
And
let's get back to the let's get back to
so
the thing.
One of the more, I think, harmful things that RFK Jr. has done, which is, I think, why a lot of physicians are really concerned about his pick for the head of this department, is that he spoke out a lot against vaccines, specifically measles vaccines in Samoa, which we will link the article in the show
Yep.
notes about this particular instance. But basically, there were a couple of cases of people who had died from accidental mixture of the vaccine with another ingredient, and everything paused. They redid all they researched what was going on, found the culprit, and then got things back on track.
Mhm.
But then when they put the vaccines back out there, he had spread all this information about how it was the actual vaccines that were causing this harm. And so then a huge measles outbreak happened, and lots of people died, like 80 something people died, and many of those people were children. And so it's just heartbreaking to know that somebody who had no evidence to back what he was saying, no
Mhm.
research, no education in science and medicine and children's illnesses, came out and spoke out against it, and people died. Children died because of it.
Right. It's just an issue with people talking outside of their expertise on things. I think it's fine to say, I have concerns about this. I'd like to learn more information. I'm hopeful that we'll get to a solution. But saying things like, don't take a vaccine without all of the information is actually really harmful and dangerous. And those are sort of the pattern that is existing that is concerning to us as physicians, I think.
Yeah.
Yeah.
And for us as psychiatrists, he has made a statement before where he suggested that antidepressants might be the cause of gun violence that we're seeing in like these school shootings.
Should we play the video?
Yeah, let's play the video.
In the past 20 years, there's been no per capita increase in the amount of guns we have, and yet these killings, these mass killings, have exploded. And we need to look at, at other reasons for that as well, a potential reason. NIH has not studied the etiology or the cause of gun violence since 1996. And NIH needs to be studying them to see if there's connections to some of the SSRI and psychiatric drugs people are taking, whether there's connections to video games.
So, as you can see, he makes comments on the NIH not, studying gun violence since 1996. For the record, he said this in 2024. And you can see on the NIH website that there have been studies funded in 2022. Basically, what's true is that there was a lack of research on gun violence from around 2009 to 2019. And you can see this, anyone has access to scholarly information. What I do if I don't like log into the system that I have access to is you can just go to scholar.google.com and search for scholarly articles.
And make sure that, you're looking at articles from journals that are reputable and have been peer reviewed. So that means lots of people
Mhm.
within the field and the article is coming out have reviewed this article to make sure it's accurate and that they've done their due diligence in the research.
Right. So that's a nice place to start. And it would take 3 seconds to go on Google and Google scholarly articles on gun violence and just check the source,
Yeah,
right? So what he said is not true about there not being studies on gun violence since 2000, or what did he say, 1996? That is just not true.
completely false.
And then, you can see in the video that he insinuates that maybe it's antidepressants that are causing school shootings. And there are literally no articles that reference school shootings and antidepressants that have
There's,
studied those together.
yeah, there's literally no research on this, which if that is his concern, what I would hope to see is that he uses his millions of dollars that he has to fund research on school shootings and antidepressants. If that's his theory, like put your money where your mouth is and help us get more research on this.
Right. And mental health research is grossly underfunded. So yeah, come on, let's do it. I'll help you. Not really have too much going on right now in my life, but there is someone who will help you. I am
There are
sure.
lots of people
I am
who would
sure.
love to research and get more information on school shootings because it's all a lot of like hearsay right now. We don't have a ton
Yeah.
of research
Yeah.
on, what's kind of behind mental health in relation to school shootings.
Well, one thing we do know about mental health, specifically antidepressant use and school violence, school shootings, is that use of antidepressants goes up about 20% after there is a school shooting. And that
In that
in that school,
population.
population, yeah. So basically, we know that school shootings are traumatic, and people who experience trauma sometimes have problems, and people who have issues with PTSD or depression or anxiety or whatever respond to treatment with antidepressants. So, in fact, I would say the inverse is true,
Mm-hmm.
that in some cases, not always, obviously, school shootings lead to antidepressant use, not antidepressant use leads to school shootings. So, I think that's a very clear answer that we don't have that information to support that claim, that the information that we do have does not support that claim, and that spreading this misinformation is going to prevent some people from receiving treatment that they need for their mental illness.
Yeah, and probably some teenagers, right? Like young kids, like their parents are going to hear this information and think, oh, antidepressants lead to school shootings. I don't want my child on an antidepressant. And then you're going to have children with undertreated mental illness and teenagers, and who knows what that might lead to more school shootings. Like
Mhm.
you need to be more diligent about what you're saying, and especially if you're like a public figure and talking about these things and suggesting correlation or causation is just not responsible. And I'm disappointed that he's going to possibly be the department head of Health and Human Services, which Health and Human Services have actually been harmed because of this man.
Right. Totally. Yes. I'm hopeful that maybe this will not happen, but I think that it's absurd, and I for one will be leaning into my lack of imposter syndrome, because if this man can lead the Health and Human Services, I can do anything I freaking want.
I think that also leads us to like, where are you getting your information from? I think it's really important, even because somebody is a doctor or a physician,
Yeah.
doesn't necessarily mean that the information that they're giving out is true and reliable. And so I think it's important to, unfortunately, in the day and age we live in, to really look at what is this person saying? Can I find research to back that up, or are they
Mhm.
citing research to help me understand that this is true?
Mhm.
And what are they gaining from giving me this information? A lot of people who are out there giving us information actually are having huge financial gains from the misinformation that they're telling you.
Mhm.
So it's really important to look at what are the gains that this person is getting from telling me this specific type of information or this piece of information.
Right. And one thing really important to look at is if someone is telling you there is a problem and they can fix it themselves, that usually should be a red flag for you, right? We are not telling you there's a problem and we can fix it. We are telling you, here is the information, here is what, the data shows. Please do with that what you will, right? That, if someone is saying, here's a problem that you didn't know you had, but guess what? I can fix it. Red flag, right? No matter what their credentials are. Sometimes, that's not always the case, but I would definitely use that as a like pause moment. Let's dig into this a little bit more.
Yeah, and then just as a baseline, so below all of that, like if we're talking about like the hierarchy of what to believe, is that somebody does have credentials in what they're talking about, right? Like
Mhm.
RFK Jr. is not a physician. He's not involved in public health.
He's not a
And
scientist.
so looking for, like, does this person even have education in what they're talking about? Because education and studying this stuff and really being able, for any topic, really being able to know about the information is really important. That should be the base. Like, just
Mhm.
because a celebrity is coming out talking about, what skincare product she recommends, she's not a dermatologist. She doesn't know all the
Mhm.
nuances to skincare. Like,
Mhm.
just kind of recognizing that people need to have credentials in what they're talking about.
Right. Absolutely. We'll see what happens. We'll be here to, continue to fight against misinformation and help you know like the real deal with science. Thank you so much for being here. Please leave comments. Let us know what your experience has been like. Please like, comment, subscribe. We'll see you soon.
Bye.